I'm now in conversation with Henry Etukumoh, who is the CEO and founder of Medics2you. I've only known Henry for a relatively short time, but I've been impressed by his passion for healthcare and his ambitions for his company, Medics2you. So I'm going to begin by asking Henry to tell me a little bit about his motivation that got him involved in healthcare in the first place. So it was to do with your experiences with your family in Nigeria. Tell me a little bit about that, Henry.
Right. Hi, David. Thank you so much for having this with me. Right. So I got into healthcare, like you said, from a very, very personal experience that I had growing up in Nigeria, where I witnessed firsthand the serious implications of inadequate healthcare in the country. My mother had a decade-long battle with accessing care to manage a chronic condition that she had. And despite my father, who was an entrepreneur at the time, expending huge sums of money to pay for private healthcare that almost cost her life, my mom still suffers the effect of misdiagnosed conditions and poorly administered procedures. And that was what really inspired me to, set up Medics2you. So I created Medics2you so I can transform the primary healthcare experience in Africa to bridge the gap in accessing high quality healthcare and to give people control of their health so they can live the best life possible.
That's a wonderful story, and it really mirrors a lot of people that I've spoken to who've had similar kind of experiences with their own family, and that's caused them to get involved in healthcare and with a passion to do something about it. When did you come to the UK, and how did you translate that ambition into setting up your own company?
Right. So I came into the UK in 2006 for my first degree, and following the experience that my mom had with assessing healthcare, I decided that, and drawing on from the inspiration of my dad running his own business, I decided to that I was going to set up my own business to address the challenges or the issues that plague the healthcare system in Africa. So coming here, I already mapped out, my plan. One, to study and to acquire the necessary knowledge that is required, to run a business. So my first degree was in business management and finance. And after that, after I completed my studies, I decided to work for startups or SMEs within the healthcare space, to enable me, learn the ropes basically, and see how they have been able to, get their own business off the ground, grow and scale it, and that was an absolute valuable experience for me. Because it gave me, a very, very good idea as to what is required, to run a successful business within the healthcare space.
So tell me about the SME and the applications, healthcare applications that you were involved with from the beginning. I believe you mentioned to me before that it was a document management system and healthcare records.
That's right. That's right. So, yeah, I would say two of the companies I worked for really gave me, deeper insight as to what solutions that I can develop, for the African market. And like you rightly said, so one of it is and that project was all about digitizing medical records to make it easily accessible for clinicians during or post surgery or hospital visit by a patient. And the other end of it as well, which was a project, a work stream that I managed myself, which was the digitization of forms. So all forms used in the hospital, from some forms, basic forms of registration forms to complex COPD forms, was a work stream that I managed, within that overall project, which was highly successful and saved the NHS a lot of money. So most especially where all these records were being stored. After we had completed the project, it created more space, to expand, the hospital where they could now, have more hospital beds, and they can, treat more patients. So that was one of the projects. The other one is on point of care for patients. That's an inventory optimization that allowed a hospital within the click of a button, to have clear visibility of their stock, supply chain, ordering process, managing the implant consignments, consumables, and to reduce wastage, within the hospital. So yeah, those experiences I think were very, very critical, and gave me the needed confidence, to then take, that leap of faith, to setting up Medics2you, and I believe those solutions will be very, very much is very much required and needed in the African healthcare sector.
Yeah, so what we're talking about are solutions which improve the productivity and the efficiency of hospital staff. But of course, with medical records, having accurate information available for doctors is very important in providing the right kind of diagnosis and care for the patients. So that sounds a superb background for Medics2you. Who is involved in Medics2you, and how did you come across your partners?
Right. So there are 3 co-founders for Medics2you. So initially, it was myself running it, and then obviously I come from a business project management background. And since I was going to set up a health tech business, and we needed expertise in form of a doctor, to help further develop the product, and also the back end, which is the application itself. I'm not a developer, so I needed a full stack developer that can help with the programming and and the product build itself. So that highlighted 2 areas where I needed partners or co-founders to help join me in bringing this vision to reality. So I reached out to Dr. John Afolayan, who is a spine and orthopedic surgeon. I actually got in contact with him through a family connection, and he has been very, very instrumental in helping us shape the actual clinical team and quality assure the service that we are actually going to be providing to our customers in Africa. And then John Kumuyi, who is our Chief Technology Officer, he is based in New York. We've been childhood friends who grew up together from in Nigeria, where we were in the same choir back in the days. But yeah, he's a full stack developer. He's worked as a senior developer for NetSuite and Salesforce, and his experience in building health products, financial services products has been of massive value in creating this elegant product that we have for Medics2you.
Well, that's a fantastic story. And from my own experience of running a small business, I think one of the mistakes that many people make is to believe that you can do it all yourself when you're an SME. A lot of people fall into that trap, but you obviously haven't, because you've recognized the need for skills in different areas, and you built the nucleus of a team which can take you further with your product. So telehealth to you, you've already made a first release of the product with some crowdsourced funding. Is that correct?
Yes, that's right. So we did a crowdfunding campaign in January where we initially wanted to raise £100,000 to help with further developing the product, and surprisingly, it was massively funded by the diaspora community. They rallied around us to back and support us because they believe in what we're doing and they see the need that that this product is going to solve. They see the problem that this product will solve in Africa. Over 80% of the investors during our pre-seed round on CrowdQ was actually funded by the diaspora community, which is a good testament for our service.
Absolutely, and not only can you be satisfied with the success of the crowdfunding, as you say, it also reinforces your own belief in the needs of the African healthcare community, because obviously that message has been accepted and shared by all of your diaspora funders. So now you're on a pathway to success. I just want to ask you a little bit about the technology infrastructure in Africa. I've been involved in community technology projects across the world over quite a number of years. And one thing that I've observed is that in many ways, although the technology infrastructure in Africa, by my own reckoning, is probably not as developed as a lot of countries like the UK. In many ways, you have some advantages because it's allowed you to leapfrog technology-wise. So you're not burdened, as we are in the UK, by very slow copper wires to your property, which restrict your bandwidth, which is why I'm talking to you from a barn using my mobile phone. So in Africa, it strikes me that there's a great opportunity because you've got broadband and wireless technologies in particular, which will reach people through mobile devices. So what's your take on the accessibility of technology, high-speed access to the kind of services that Medics2you provides? Is this an opportunity for you, or is the technology infrastructure in Africa possibly a problem?
Right. So I think it's technology, like you rightly said, has helped to leapfrog us and our service that we're rolling over into the continent. If I backtrack a bit, to give a background of the healthcare situation. So at the moment, actually, I'll use Nigeria as a case study. The healthcare infrastructure is very poor, and that stems from the low healthcare spend by the government. So the government at the moment spends, I think, 3.7% of its GDP on healthcare, and that informs the state of healthcare, the infrastructure, the quality of the clinical team or clinicians that we have on ground are not able to provide the right care that is required by patients, and that has led to a massive problem of clinical brain drain, where a lot of qualified and experienced doctors have left Nigeria for further afield, and their major destination is the UK, America, and other parts of Europe. And solving that problem has been, a huge challenge. And the government, on so many occasions, has asked for the private sector to intervene, to come in, to support the government in tackling the health challenges that is being faced in the country. And I think technology is now that gap. Is that tool that can help to bridge that gap, to bridge that health divide in Africa, where it doesn't matter who you are, and because we don't have enough hands in terms of experience, clinical team on ground, most of them are abroad and are on our platform, especially the diaspora physicians, they are able to then, and these guys have done, fantastic work, in the various specialties, here in the UK and other parts of the world. So they are now able to, as part of their also giving back to their country, they're able to provide, high quality healthcare to people in Nigeria, regardless of the location. And thanks to the widely or huge adoption of mobile technology. In Nigeria, I was last there in February. Almost everybody now has a smartphone. In fact, it's a fashion statement. If you have one, you've not arrived. You need to have two or three. So the adoption of the technology, be it tablet or mobile phone, it's going crazy, and that is good news for us, because it means people now have access to quality healthcare in their hands and in their pocket, and they can use and access it anytime and anywhere.
Yeah, that's wonderful. That kind of reinforced my own kind of intuitive thoughts about the situation in Africa and Nigeria. Now finally, I guess we couldn't really have any conversation without coronavirus coming into the conversation at some point. But coronavirus obviously is a very serious problem. So I'll just ask you a couple of things. Could you maybe just say very briefly, give us an idea about what's happening with coronavirus in Nigeria? And secondly, just reflect on the fact that this may well also be something which will help to stimulate interest in Medics2you, because it will allow this remote care, which is difficult in an environment where you have to socially isolate and socially distance. So what's the situation in Nigeria, and how does this fit into Medics2you strategy?
Right. So with COVID-19, I think the Africa did not feel the negative or huge impact or consequences of COVID-19 like we did in the West. So the government had ample opportunity, to prepare and to take drastic measures, to try and curtail the spread of the virus. So quite early on, the government started, I think when in Nigeria, when they had a handful of outbreaks, the government started to shut down the airport and also impose a national lockdown. And I think that really helped, to reduce the spread of the virus. And that has also led to, far less number of deaths in the country. And my chief medical officer, Dr. John, was also involved with the Lagos State Government Commissioner for Health, where he put together a team of experts from the UK that's featured in the coronavirus workshop or strategy on how the virus can be curtailed, within the state. And that was a very successful program. And yes, COVID-19 on so many levels is a silver lining for us. It has helped to create more awareness. I mean, I was saying to someone the other day, I was in Nigeria in 2018 when I knew this, we just started off Medics2you. And when I introduced the concept of telemedicine or telehealth, people did not know what that was. But now telehealth, telemedicine, it's almost, that word is almost being abused. Everyone now knows what that is. Thanks to COVID-19, but more so, post COVID-19 era, a lot of people are now not open to hospital visits for fear of being stigmatized with the virus. And so, one, it has created two challenge. One, for the hospitals, where they're now having reduced footfall to the hospitals, and that is also reducing obviously the revenue. And hospitals are now looking for that digital infrastructure that would enable them migrate their services online and provide that remote healthcare service. and that is where Medics2you steps in, to give them the required infrastructure, or that platform that can enable them run their services as normal, and also give them timely access, to expert clinicians from internationally, that can also help them provide quality healthcare services. So, yes, I would say overall, COVID-19 has really helped to helped us, to grow, and created more awareness in the market for our services.
Oh, well, that's wonderful. Well, I'm looking forward to the webinar next week on digital healthcare ecosystems, where you'll be joined by a panel of 4 other experts to discuss the whole concept of the digital healthcare ecosystem, which I know that is part of your strategy. And also, I'm pleased that you will be involved in a webinar later this month on digital healthcare in Africa, where we can build on some of the points that you've raised today. So I just want to say thank you very much for joining me this morning, Henry, and sharing your ideas and your passion with me. I'm sure that will be reflected in the video recording. And so I look forward to speaking to you again on Tuesday when we have the Digital Healthcare Ecosystems webinar. So thanks once again, Henry.
Well, thanks, David. Thanks for having me. Thank you.